Hi, I'm Lauren Hansen, RN. Welcome to the Franciscan Alliance STEMI training video. The purpose of this video is to introduce our code STEMI process to our local EMS, new RNs, paramedics, and ED techs. As you are viewing the video, you will see a scenario followed by an educational key point. The first key point will describe typical and atypical signs and symptoms of the ACS patient, risk factors, use of a TIMI scale, and early heart attack care. The second educational point will focus on EMS arrival to a STEMI patient and transfer to the hospital. The third educational point will guide you with what to do with the patient on arrival and what meds the RNs need to give. The fourth educational point will be an overall review. I hope you enjoy the video. And remember, heart attacks have beginnings.
Hey guys.
Hey.
Jim.
Hey.
You feeling alright? You don't look so good.
Yeah, I don't know. I just woke up this morning, my chest felt kind of tight, and I don't know, maybe I just pushed it too hard yesterday, so I'm going to try to stretch it out and see if that makes it feel better.
I keep telling him he needs to go to the doctor, but he doesn't want to listen.
I don't need a doctor. That's for old people. I'm all right.
You guys are good to go.
All right,
okay?
thanks.
Thanks. Jim, what's going on? Are you okay?
I don't know. It just feels a lot worse than this morning.
Jim, you really don't look so good. Feeling alright?
No, I'm struggling. I think I need help.
Alright. Why don't you stay with him? I'm gonna go call 911.
Do you want to lay down? Are you okay?
Hi, I'm Dr. Eric Cook, Chest Pain Center and EMS Director at Franciscan St. Margaret's Healthcare Centers. I'm here to provide you with the educational key points after each scene of this video. In this first scene, Jim is having signs and symptoms of acute coronary syndrome. As healthcare providers, it is important to recognize and then act when these symptoms present themselves. EHAC is an important educational initiative in understanding that heart attacks have beginnings, and signs and symptoms of heart attacks can present days to even weeks before an actual heart attack occurs. These symptoms are categorized as typical or atypical. Typical signs, or the big five, include chest pain, shortness of breath, palpitations, dizziness or lightheadedness, and diaphoresis. Atypical signs and symptoms can be vague and seem to occur more commonly in women or patients with comorbidities such as diabetes. Weakness, fatigue, nausea, indigestion, pain in atypical locations such as the jaw, teeth, or back, or in a sense of impending doom, i.e. I just don't feel right, are among these symptoms. Risk factor recognition and assessment is equally important in this early stage. Age, family history, gender, smoking, cholesterol, obesity, diabetes, hypertension, are among these risk factors. We utilize these factors into a risk assessment called a TIMI score. The score is used to categorize the risk of death, ischemic events, and the need for emergent revascularization in the immediate future with patients experiencing unstable angina or non-ST elevation myocardial infarction. The TIMI score is calculated by assigning points to categories. These categories include age greater than 65, aspirin use in the last 7 days, at least 2 anginal episodes within the last 24 hours, ST changes of at least 0.5 millimeters on admission EKG, elevated serum biomarkers, known coronary artery disease, i.e. coronary stenosis of greater than 50%, and at least 3 of 5 risk factors for coronary artery disease. These include hypertension, high cholesterol, cigarette smoking, diabetes, and a first-degree family member who has coronary artery disease under the age of 55.
It's okay, Jim. The paramedics are here.
Hi, sir. My name's Rob. This is Jeff. We're paramedics from the fire department. We're here to help you. What seems to be the problem today?
I woke up, my chest felt kind of tight, but I came here and started working out. Now it's real heavy and I'm having a hard time breathing.
Is it in the center of your chest or does it radiate anywhere?
No, it's right here, but it feels like it's going over to my left arm here.
Okay. On a scale of 1 to 10, what's your pain scale?
I guess like a 9.
Okay. All right, I'll tell you what, sir. We're going to go ahead and put you on some oxygen. After you've been on the oxygen, I want you to let me know if that pain has gone away or it's improved at all.
All right.
Okay, here you go. Do you have any medical problems that we should know about?
High blood pressure and high cholesterol.
Okay, are you allergic to any medicines? Let's take this off for you. All right, so we're just going to put these stickers on your chest. Push it up here.
Does it hurt?
No, it's not going to hurt at all. How old are you?
48.
48. Thank you. What were the vitals, Jeff?
Blood pressure is 122/78, pulse 72, respiration is 20, lungs are clear.
How's your pain after the oxygen, sir?
Don't feel any better.
Does it feel any better? All right, we're going to go ahead and start an IV. We're going to give you some nitroglycerin under your tongue. We're going to give you some aspirin. You mentioned that you weren't allergic to any medicines, correct? Okay. We're also going to give you something for pain.
We're going to transmit this 12 lead to the hospital so the doctor can look at it before you get there. And then we're going to transport you to an accredited chest pain center.
The educational key points in the second scene of this video include pre-hospital EMS care. Pre-hospital care has become of paramount importance. Our EMS first responders are on the front line with first contact of patients experiencing chest pain or acute coronary syndrome. They need to do a quick assessment of history, risk factors, and pain level. EMS personnel then need to obtain vital signs, apply a monitor, O2, establish an IV, and then determine the need for interventions. Most patients having chest pain or symptoms consistent with acute coronary syndrome need aspirin, nitroglycerin, sublingual or spray, and most importantly, a 12-lead EKG needs to be performed and transmitted to the receiving facility. Report needs to then be given to that receiving facility. Minutes matter with patients experiencing acute coronary syndrome. It is with this efficient and timely action that patient outcomes improve.
Franciscan Alliance, go ahead.
I did a paramedic 7. We're currently around your location. 52-year-old male patient has chest pain radiating to his left arm. Had an episode this morning that went away, but while working out today, the pain came back. Pain initially was an 8 on a 10 scale. We've already transmitted a 12-lead EKG to you. We have an IV established. We give him 4 baby aspirin and 1 nitro. Pain is now a 4 on a 10 scale. Vital signs, 122/80, pulse is 72, respiration is 18, lungs are clear. Skin was initially pale, diaphoretic. At this time, color is returning and skin is drying up. No history, no medication, no allergies. We have an ETA facility in about 5 minutes.
That's a copy, Hammond. Follow your SMOs. Recontact as needed. KBM 595, St. Margaret's out. Dr. McGovern, they just faxed this EKG over on a chest pain.
This is a STEMI. Activate cold STEMI and have the unit clerk page on-call interventional cardiologist stat.
Okay.
That's 52-year-old male complaining of substernal chest pain, radiating to left shoulder. Happened this morning, went away while working out, it came back a lot worse. Be given 4 baby aspirin, 1 nitro, pain went from a 6 out of 10 down to a 4 out of 10. We already transmitted the 12 lead.
Hammond, can I get a name?
First name's Jim, wife is behind us somewhere, she has more information.
Hi, I'm Dr. McGovern, the ER physician. The EKG that the paramedics did in the field is showing that you're having a heart attack. I've already spoken to the on-call cardiologist, and the cath lab is on their way. You're going to need a procedure in angiogram. It's called percutaneous coronary intervention. We're going to put some dye in and look at the vessels around your heart. Nurse, can you activate the STEMI EBOS?
Do we want to repeat EKG?
Yes, can you please get a repeat EKG?
You're gonna feel a pinch here, sir. I'm gonna draw some blood at the same time.
Oxygen at 2 liters.
How's your chest pain right now? Listen to you, too.
It's a little better. They gave me something melted in my mouth or something. I don't remember what they said it was.
What's his heart rate right now? 110.
Let's give
His
him
blood pressure is 146/76.
50 of low pressure, 600 of Plavix. Get him on a nitro drip.
Oxygen 96%.
I'll get the meds from the STEMI box.
Respiration's 33.
And paramedics gave aspirin en route, I understand. Is that correct?
Correct.
It's got another IV. It's the right forearm.
I need you to
20
try and lay
gauge.
really still for me, hon. As still as you can for just a minute.
Gee, what kind of medical problems do you have?
I have high blood pressure and high cholesterol.
Okay, and you take medications for those?
I do. Lisinopril and
Simvastatin?
There's a monitor.
Okay. Who's your regular doctor?
Family doctor that I just see him, once a year for follow-ups and physicals and
Okay,
Jim,
that's
we have
fine.
to shave your groin.
Put more monitors on you, sir. For the transport.
Yeah, start on
Still
0.9
feel
at
okay?
100
Groin and
cc's
shave.
an hour.
You doing okay? Yeah? Okay.
Are you having any trouble breathing with this, Jim?
Oh, it's much better than it was.
Okay, let me just take a listen on your lungs.
Nancy,
Take
he's
some
got
nice breaths for
0.9
me.
saline running at 100 cc's an hour.
Couple more breaths for me, Jim. No swelling. Jim, let me take a look in your throat here. Great, and your eyes, open your eyes for me.
How's your chest pain right now?
It's there, but it's definitely better.
Okay,
Can you rate it on a scale?
Maybe 3.
Chest pain is a 3 out of 10.
like I said, the cath lab and the cardiologist are on their way in. They're going to take real good care of you, okay? Your
Thank you.
pain's already getting better, so that's a good sign.
X-rays here.
So we're going to need to have you sit up and do that first. Can you sit forward for us?
The third and fourth scenes of this video involve the recognition that our patient Jim is having an ST elevation myocardial infarction being brought in by EMS. However, many of our patients present to the ER as walk-in to triage, and this initial recognition and EKG needs to be performed immediately by the triage staff. Jim needs PCI in the cardiac catheterization lab as quickly as possible. Initial interventions are done in the ER to prepare Jim for the cath lab. 2 large bore IVs are placed, defibrillation pads are applied to the chest wall, and bilateral groin hair is clipped. In preparation for transport, a portable monitor and O2 tank is placed on the bed. Portable chest x-ray needs to be performed, and medications from our STEMI box are to be administered. Unless contraindicated, these medications include aspirin, nitrates, beta blockers, Plavix, and heparin.
Hi Jim, my name is Bob. I'm one of the cath lab nurses. We're going to be bringing you for your angiogram momentarily. We're going to explain the procedure and have you sign a couple consents while we're walking to the cath lab. Do you have any questions? Okay.
Hi, Lori. Hi, Judy. This is Jim. He's a 52-year-old male brought in by EMS. Okay. Was at the gym this morning, started having, became nauseous, started having some chest heaviness. Okay. Happened approximately 30 minutes ago. Okay. Does have a history of high blood pressure and high cholesterol. Okay. He takes simvastatin and lisinopril. Okay. He has no allergies to medications. Okay. He was given 3 nitroglycerin. Okay. 2 in the field and 1 here in the ER. Okay. 2 milligrams of morphine. All right. By EMS. Also given 4 baby aspirin, 81 milligrams. Okay. By EMS. We gave him 600 milligrams Plavix here in the ER, 25 milligrams of low pressor PO. Okay. And then we gave him a heparin bolus, and that's to protocol. Okay. Good luck, Jim. Good luck, Jim. Take care.
In this last scene, Jim is being taken to the cath lab. In 2012, the ACC AHA guidelines recommend a door-to-balloon time of 90 minutes or less in a patient experiencing a STEMI. As healthcare providers, we need the knowledge, tools, and training to efficiently treat the patients we are charged to care for. For this to occur, our healthcare systems need to change. Through process change, we can improve patient outcomes, satisfaction, work performance, and decrease waste in our systems. Our policies and protocols have to be up to date with the latest evidence-based medicine to ensure efficient and effective timely care for our patients. Minutes matter when a patient is having a heart attack. Minutes could mean the difference between a fulfilling life and a cardiac cripple. I hope you have learned and enjoyed this video.